Hello, everyone. Heather Holmes here with KTV Fox 2 News in the San Francisco Bay Area. And I'm joined once again by Dr. Rashid Chaitani. He is an infectious disease expert and a COVID-19 researcher. And he's been joining us the last couple of weeks to help us digest all of the COVID-19 news. Doctor, thank you so much for being here.
Well, thank you for having me. It's a pleasure to be on your show as usual.
Let's dive right in and talk about what we're seeing, which is a number of states, including here in California, seeing the number of COVID-19 cases increase. How concerning is that to you?
It's extremely concerning. It's not just California, but there are other states where we are seeing surges, and there are some states where they are worried about hospital beds and intensive care beds. It is of tremendous concern, and there are things that have happened in our nation after the Memorial Day weekend, after the protest, and all the other things that are going on that have absolutely influenced the resurgence of the virus in the community.
So, your advice to people right now here in California, the governor has mandated masks. Anytime you're outside where you're unable to socially distance, and when you're inside at places, do you think other states should be doing the same thing?
I believe that wearing a mask is definitely a very, very effective way of controlling the spread of the disease. And we've talked about it, and experts have said it. And this is a message that has been resonating by, reiterated by so many people that, and, and we have data now, clear data that suggests that if people were not wearing masks, we would have approximately 400,000 more cases. So let's make sure that everybody's wearing a mask. Nothing wrong with wearing a mask. Yes, it is not as comfortable as one wants to be. We are tired of this disease. We are tired of staying at home. We are tired of these precautions. We are tired of wearing a mask. But unfortunately, the virus is still here. Virus is not going anywhere. So in order for us to protect ourselves, our families, our neighbors, our country, we've got to take some measures. We do not have a cure. We do not have a prophylactic, meaning a therapeutic or a drug or a vaccine. What do we do till we develop all those modalities? We've got to use the common sense measures, and masking is something that does help. So let's wear a mask.
There is a lot of concern about a big rally by President Trump this weekend in Tulsa, Oklahoma. Are you fearful that it too could lead to a spike in cases?
So, first what happened in the United States was that we opened up before the Memorial Day weekend, and a lot of people got together, congregated. Then after that, we had the protest for Mr. Floyd, and then things have just escalated after that in terms of protests and people getting together. Today, there are massive protests or celebrations actually going on across the nation, in Washington, D.C., a lot of other places, where people are getting together in large numbers. When people get together in large numbers in open space, yes, there is still a risk of infecting one another. If they wear masks, that's fantastic. If they keep within the group that they're with, or small groups, it is good. But still, there is a risk involved in it. That's a constitutional right that people have. On the other hand, when you have political rallies, right? That's also part of our process and system, and that should happen. But let's make sure that we all are cautious. We are all wearing masks. We are observing the common sense measures. I wish none of these things were happening right now, to be honest about it. But in order for our country to do what it wants to do, is allow all these things. So if we're going to do them, let's do them with complete amount of maximum care in terms of wearing a mask, making sure that we are social distancing. The ideal thing, to have it indoors versus outdoors. Outdoor is a little bit safer than having it indoors. Studies have shown that disease does not spread as widely when you're outdoors. But both of them are of tremendous concern to me, and we will see the rising of cases. We expected that the cases were going to rise once we opened the states, but we expected that it would be a small bump. We never expected this other issue that came about in the United States after Mr. Floyd and Mr. Rashad's death. And these things have just escalated the gatherings and people getting together. Plus all these other events that are going to subsequently happen in terms of what is happening today, what is going to happen when President Trump has his rally. All of them are going to influence the spread of the disease. I mean, this is not rocket science, my friend. This is something that we all know. So let's be very careful when we do all those things.
I want to sort of look ahead now. There's a lot of talk amongst parents and school officials about what the school year is going to look like, not only for youngsters, but also, those going to universities. Let's talk a little bit about the precautions that you expect to be taken and how optimistic you are that in classroom teaching is going to happen.
So one of the biggest problems that we are having right now across the nation, which is unfortunate, that our online learning system is not as efficient as we thought it was. And I'm saying that being a parent, and I see that happening in Virginia with my kids. So it's not as efficient as we thought it was going to be. So it's not really working as well as we expected. The same thing is true with colleges. Right now, we have a few months to work on those things, to develop better technologies, better platforms that online teaching can happen. But a lot of colleges, universities, and schools are planning to open, especially private, that a lot of them are doing are developing technologies or methodologies or processes where their students are going to be tested on a regular basis. There are multiple universities that have started that process. Multiple private schools, specifically that I have at least been talking to in the are developing a blanket methodology or process for testing every single teacher that they have, and then the students, and then having repeat testing on them, having processes such as fever, temperature checks, symptoms check, before they go to school. So thinking about checking temperature of the students when they come into class, making sure the faculty is tested negative. So all of these things have to be done. Now, the big problem that we have still, and we've talked about it previously, is the problem of having the capacity of testing. We just do not have the capacity of testing right now. We have PCR. We have right now, the incredible thing that is happening is that we have the saliva test. It's very simple for the kids, especially. But we don't have it in abundance. We really need massive amount of testing capacity in the nation so that we can test people.
What about an update on the vaccine? How hopeful are you that we are going to see a vaccine sooner rather than later?
So one of the important things that we have all to understand is that yes, we are the nation, and there are three major companies that have been kind of like put up right now, which are developing the vaccine as fast as possible. The problem again is, and at the same time, they're manufacturing the vaccine. So the nation has invested a lot of money and taken a tremendous amount of risk, because once the vaccine is developed, right, we have to know if it is safe or efficacious. We might have vaccines, multiple vaccines that that we are talking about in a while, but we might not know by December, or I would say next year, first quarter next year, if they're really, really efficacious and safe to be used in what I call a mass vaccination campaign. That means that everybody in the nation is going to be getting that vaccine. So we still have a long way to go in regards to the vaccine. We're also working very hard on therapeutics. And there is one new drug that has come out, which has shown to save lives in a significant way, which is an old drug, which is dexamethasone. But again, it can only be used in patients who are extremely sick. It is not to be used in patients who are moderate or who have moderate or mild disease. currently, for those patients who are in intensive care unit, one of the things that has worked across the world, and it has worked in the United States, is convalescent blood or plasmapheresis. And one of the things that we still have to do as a nation is to get a hold of how we run that program. And a couple of months ago, I wrote an op-ed which was in Fox News, or maybe some other newspaper, I can't remember, sorry, talking about a national registry for people who have developed potential immunity, so that we can keep a track of that and make sure that if there's nothing else and the only thing that is working is plasmapheresis, we are able to go to those people that potentially are immune to the disease and get their blood. And we're still working very hard and pushing that agenda, but we've not gotten there. A lot of research is going on at this point. A lot of blood is being collected in by different organizations, as well as Red Cross. And Red Cross has said that they're going to start testing all their blood that they have for the antibody for IgG, to see if that blood might be good for plasmapheresis for anybody that might need it.
Yeah, obviously a big announcement on the part of the Red Cross for what they were trying to do, especially to meet the blood donation shortage that is happening right now. As we begin to wrap up, though, Doctor, I just want to talk with you about this idea of, do you think that Americans have sort of kind of given up? You know, we've had enough of the sheltering in place, and therefore we've just maybe become a little too relaxed in the face of COVID-19?
Well, it's not just Americans. Yes, Americans are tired. It's all over the world. People are just tired of this disease. They want to get out. They want to go back to how things were. And one of the things that is something that we've got to understand and appreciate is that things are not going to be the same for a pretty decent amount of time. It is going to be difficult. And one of the things that people have to get used to is wearing a mask. Making sure that they're keeping social distance, making sure that they're doing hand sanitization. It is not something easy, because to be honest about it, if you think about it, right? A lot of our developing countries, United States, when we go out, it's clean. Everything is, there's no, we try to see our homes are clean, they're controlled, our offices are clean, they're controlled. We are very, very big on cleaning things, right? So by looking at things, everything looks fine. I look fine right now. But if I go out at this point, I will wear a mask. I'm in my office, I'm not wearing one, which is fine. But those are the critical things that we've got to do. Yes, we are tired of it, but we've been doing this thing for quite a few months now. Let's not stop at this point. Let's continue to work and be careful and cautious.
All right. Well, thank you so much, Doctor. Hopefully the next time I talk with you, we'll see the number of cases on the downward trend instead of the upward trend that we're seeing right now. Really appreciate it. Really appreciate it. You have a great weekend. Thank you so much.
Thank you so much for having me, and have a good day.